All right. Thank you.
Still looking for store. She said my name come from me just put it away.
Hi, hi, hi. How are you guys doing? Trying to share this live. All right. Well, what are you guys up to? How was your day? How was your weekend? RN to CEO, welcome, welcome. How are you doing? Fire Kush, welcome. Stacy D, Novlet, McCain. I don't know who is here. Charles is here because Charles did put in a little message. Hi, Charles. How are you doing? Biggie, welcome, welcome, welcome. Again, Charles. All right. How is that going? Good? Okay, nice, nice, nice. Yeah. You work today or you were off today? Color green. Who, you? Or your color red? Because I'm seeing a red. Off today? Okay, nice, nice, nice. Yeah, I worked today. I did work today. Wasn't bad. Wasn't a bad day. Sunny hot though. Yeah, I was just coming from the library. And may I tell you, when I go outside, the temperature, but in the car it says it was 109. I don't know what the official temperature today is. Let me see. Well, it says 95 degrees outside. No. Yeah, but it was hot, hot, hot. Yeah. Remember to go ahead and share the live as well. Thank you so much. I appreciate that. I appreciate that. Oh, let me go ahead and try to tag this thing or pin this comment down below. So pin. So just in case you're new here, you can also follow me or subscribe to my page on YT at ThinkNursing. All right, it's one word. And I'd love for you guys to go ahead and follow me here as well on TikTok. All right. I share nursing content as an emergency room nurse practitioner, you know, in the making. Well, I do house call as a nurse practitioner, so I share my stories and I just give like tips and everything. I want to talk with a few nurses, have them on the show here, and hear about show. See me, I speak it into being. Yeah, have them on the program here on YT, on TT as well. So definitely, you know, if you're one of them and you have a story to share, you can link me up. I'm trying to get that a little bit more organized in terms of the podcast, you know, but I definitely want to talk with a lot of healthcare workers, sharing their day in the life, you know, their experiences, working abroad, here in the States, wherever it is. Yeah, and then from there, are you a specialist? General care. Oh, I do geriatric, Charles. Adult gerontology. That's my area. All right. So I deal with the older folks, not the baby mamas. All right. Or the pediatrics. All right. Hi, Romaine Johnson. How are you doing? Thank you so much for tuning in. Yeah. So, hi, Kayla. Kayla is a shy one. She never wanted to talk the other day. All right. So I was just waiting for a few more persons to come on. Okay. Where are you joining in from, Romaine? I remember to go ahead and share the live with one person. Just one. Not asking for too much. 10 would be nice, but you know, just one. Not going to be greedy. All right. I remember to double tap the screen, like up the live so I can actually go to other persons, and remember to go on my page and watch 2 videos, laugh, and then do all the wonderful things on the side that they say that the algorithm acknowledges and recognize as you being human and engaging. All right. Okay, nice, Romaine. So today I'm just going to talk a little bit about, so I'm doing a nursing series where I'm talking, you know, a little, you know, nursing content, tailored mostly to, like, you know, your new grads as well as your transitional nurse. So yesterday I did a video, or we did a stream yesterday. I am going to upload it to my YT page. It's the entire full length. All right. So just in case you miss any other streams, you can always go over to YT and watch those videos. They're a little bit longer, so you'll recognize them a little bit better. All right. And then from there, I'll try to cut up, you know, or try to do shorter content. So just in case, you know, your attention span is short as mine, then you can watch those as well and get the content. All right. So we're going to talk a little bit about NCLEX Prep and some English exam that, you know, you definitely need to get in preparation for the US here or to sit the exam. And we're talking about the IELTS exam. All right. So I don't know how many persons are nurses here. If you don't mind, you could just go ahead and say me, you know, that way. Something like that, just to identify. And if you've started the process for NCLEX or not, or if you're in the process, you can always just go ahead and say something down below. All right. Hi, Tayam. And if you have any questions, as usual, you can still go ahead and ask anything related to nursing and I'll answer it. But this is my program for today. All right, in terms of the topic and the layout, and as I say, if there's anything that is random, feel free to go ahead and ask and I'll stop and answer as best as possible. All right. And share. Okay, so it is what, 7:15. All right. So we're going to talk a little bit about the NCLEX preparation. So usually once you've gotten your bachelor's of science, then you'd go and sit the NCLEX. So preparation actually start from the initial phase where you started your nursing program. So the NCLEX is not like the regular exams. It's a little bit different because you have your fixed questions, and so it's more like a computer adaptive way of testing. All right, so depending on how you're doing on the test, then the computer itself, it adapts to you as well. All right, so for example, you are doing you're answering the questions correctly. What it does is that it continues to get a little bit harder. If, so for example, you mess up or the answer is incorrect, then it goes down a little bit easier, and then from there, you know, it adapts to how you're going about. It will continue with keeping testing you until it is sure whether or not you're above or below the passing standard for the NCLEX. All right, so the goal of the exam is not necessarily to finish in time, like, you know, pretty quick, as we always say. You know, we want to make sure that we're mastering and getting the necessary answers correct. Let's just see. So it's all about, you know, and then the NCLEX is all about making sure that you're competent and you're practicing safe. You're answering correctly in terms of how you'd manage a patient as a nurse. All right, so remember that. So it's not necessarily about how fast you complete the exam, but in terms of competency and safety for the patient, that's what you're being tested on. All right. There are different areas that they test in the NCLEX, and a lot of times the testing, you'll see the different areas that have different percentage, and you have to try to get a certain amount in order for you to pass the exam. One of the content area is the management of care, where usually it talks about, like, you know, what would the nurse do first, second, third, things like those. Then it also looks at safety and infection control, where you talk about your PPE order. It also talk about like isolation, like what PPE would you put on first when you're approaching a patient's room who has like an infectious or any airborne, you know, disease, anything like that. So it will ask question related to that. Then it also does a lot of pharmacology, and the focus is usually on the high-risk medications. So anything like your digoxin, anything like potassium, insulin, focus on those, know the side effects, and, you know, just make sure you know like the lab values that you would check for certain medications. And then you also have priority and delegation. They want to know how you would go about with delegating or assigning duties to your, you know, your support staff, your LPNs, your CNAs. You must be aware of your scope of, you know, or your scope of practice, your responsibilities, your roles, and what you are responsible for and what you can delegate to other persons. So in a sense, you definitely need to be familiar with the roles and responsibilities of the LPNs, the CNAs, and all. All right. So one thing I would encourage persons to do when you're doing, you know, when you're prepping for the NCLEX is to make sure that you try to create, like, you know, daily schedule. So if it means you're going to try to put in at least 1 hour, 2 hours per day, just to cover certain topics. So that way, by the time you reach, you know, at the time for testing, it's not going to be difficult, or you've covered a lot of content already in preparation for that. All right. And the most important thing is that you develop some form of consistency. Try not to cram too much. All right. You want to have consistency with studying, so that way by the end of, you know, your study period, you're not like cramming to get certain information in, because then you will start to feel a little bit more overwhelmed. You'll also feel, you know, I don't think you probably get enough sleep during that time, and there's a high possibility because of exhaustion, stress, anxiety, you might go in the exam and just fail it. All right, because of that. You can also use different question banks, or, you know, testing question banks. So you have like UWorld, Kaplan as one, and I see where it says Archer, and try to do like, you know, questions like 50 to 75 questions per day, and try to make sure you understand the rationale behind each question that you're doing. All right, even if you don't get the answer correctly, try to read on those, the incorrect answers. Try to read on them just to broaden your knowledge and see why that answer is not an option for that question. All right, Q and Ash, thank you so much for tuning in and liking up the live. Andrea, welcome, welcome. All right, and I see some other persons here. Thank you so much for tuning in. And as I say, if you have any questions, feel free to go ahead and leave them in the comment box. Well, not comment box, but down below. All right. All right. The other thing is that you want to make sure with the select all that apply questions, you'll have a lot of those on your on the NCLEX. So you want to make sure you are trying to think about the answers, think very deep. Do not be fearful of those questions. You understand? Do not be fearful of those questions. Make sure you're thinking real deep and hard regarding the answers that you'll be choosing, and make sure you're answering each question or treating each answer as a true or false when you're doing all of those those select all that apply question. All right. And then the most important thing is you're training yourself. During that time, train yourself to be thinking as a nurse. You're not a student nurse anymore. You're not, anybody else except a registered nurse. So even though you're sitting the exam, you're sitting the exam in the capacity of a quote-unquote nurse. So you're answering those questions as if you were at the bedside working. What would you be doing in your role? All right. What would be your responsibilities be at that time? What would be the safest action for you at that time? All right. And not say necessarily thinking like, what did the textbook say? All right. So you want to make sure you start training your brain to be critical thinkers, and so that way when you go in the exam, you're thinking along that line as well as if you're a nurse. All right. Gwendolyn Walker, welcome. Ulu, Asan Yusuf, welcome. All right. And then you always want to go ahead and memorize your answers instead of you want to go ahead and make sure you're not memorizing your answers, because a lot of times we tend to SWOT, and when we go into exam we can't really explain it, and if we don't see the answer correctly, then we tend to be a little bit flustered, or we just tend to choose the wrong answer, or we get so anxious we mess up the remainder of the exam. To try not to do that, all right, always try to start with your areas of weakness. So for example, cardiovascular is not yours, or neuro is not your thing. Always go ahead and start with those areas that are hardest for you, and then from there you can tailor yourself up to the easiest part of the study materials. Good morning from Nigeria. Good evening from Texas. All right. Thank you so much for tuning in, Olu. All right. And so that's what I would say regarding that part of the NCLEX. When it comes on to the NCLEX content areas, it's a little bit broad, and so I'm going to just touch on a few things regarding like different areas when it comes on to like management. So when you talk about the management of care, there is a certain percentage that you want to get, or that's the amount of percentage that the exam itself comprised of in terms of the management, in terms of safety, in terms of medication. So management of care is like 17 to 23%, and the focus is more on prioritization, delegation, legal and ethical responsibilities. So they may ask you questions such as, which patient you might see first as a nurse. And as I say, you're thinking along the line as a registered nurse, even though you're sitting the exam and you're not fully like, a nurse, but you're thinking, they're preparing you, and so they're expecting you to be answering in that manner. So they might ask you, which patient should you see first? For example, A, is it the patient with a blood sugar of 250 milligrams per deciliters? Is it a patient with chest pain and shortness of breath? A patient with headache asking for Tylenol? Or a patient due for routine vital signs? And I'll have you just go ahead and you can tell me down below, which of the patient would you see first? You can put A, B, C, D. I'll go them over. A is a patient with a blood sugar of 250 milligrams per deciliter. You can have a patient with chest pain and shortness of breath, a patient with headache asking for Tylenol, or a patient that is due for routine vital signs. All right, and while we're thinking about it, I'll just kind of look down here and see who is here. All right, B. Okay, so Ula says B. Nice. Roween, welcome. All right, so as I said, the first one is A a patient with a blood sugar of 250. B is a patient with chest pain and shortness of breath. And C is a patient with headache, asking for Tylenol. And D is a patient due for routine vital signs. Sweet Susie, Gregory, thank you so much for tuning in and sharing the live. All right, so Ulu, yes, B is correct because of, you know, the chest pain, the shortness of breath. Out of everything else here, or all the patients here, that patient has something that is potentially, like, you know, life-threatening. So the chest pain can be, you know, it can be cardiac, it can be non-cardiac, but we're gonna say it's cardiac and life-threatening, and the shortness of breath. All right. So, and that's for when you're prioritizing. That's an example of prioritizing. So you'll decide which of these are more serious. Is it the glucose of 250? It's high, but, you know, patient is not going to die. The headache, asking for Tylenol, you know, headache, asking for Tylenol. We're not going to put anything else in the question. We're just going to read the question as is, because that's how you're supposed to be thinking. This is all they're, you know, they're presenting. So a patient asking for Tylenol, not really an emergency. A patient due for routine vital signs definitely is not a emergency, just because of, you know, the routine vital signs. So out of all of these, we'll definitely go with B because of the chest pain and the shortness of breath. All right. Which task can you delegate to a nursing assistant? Is it feeding the stroke patient with dysphagia, taking vital signs on a stable patient, or educating a patient about insulin? So which one can you delegate to your nursing assistant? Feeding a stroke patient with dysphagia, taking vital signs on a stable patient, educating a patient about insulin. Ulu says A. Let's see if anyone else will say anything different. Thank you, Marlene, for tuning in. So feeding a stroke patient with dysphagia. B is taking the vital signs on a stable patient and educating a patient about insulin. So April says vital signs on a stable patient. All right. Do we have a third? Do we have a fourth? All right. Going once, going twice. All right. And this one is delegation. So we're going to go with B, which is vital signs on a stable patient. Ulu, I know you said feeding a stroke patient with dysphagia, but you have to remember that this patient is at risk for aspiration. So you want to make sure that RN is doing that part. And especially, you know, if the patient has dysphagia, depending if you've done the exam, you know, to the swallow test, the evaluation, then definitely if the patient fail it, you can't feed the patient. All right. But definitely this would be the RN who would be dealing with this patient, just because of the risk for aspiration. Taking vital signs on a stable patient, definitely definitely the nursing assistant can do that one. And educating a patient about insulin is always going to be the nurse's responsibility when it comes on to education. All right. So education is incorrect, as well as feeding that dysphagia patient, that stroke patient. All right. So management of care is about thinking like a charge nurse, who is safe to delegate, who needs to, you know, be seen right away, and how you're going to be preventing any form of harm. So those are the things you want to be, you know, be thinking about. All right. Then you're going to have also safety and infection, and safety and infection usually covers about 9 to 15% of the exam. All right. And the focus is on accident prevention, standard precautions, and isolation. All right. So usually for the PPE, those are the precautions. You want to go ahead with donning. So there's a specific order that you will use for your when you're donning. So you want to do your gown, your mask, your goggles, and your gloves. All right. And then when you're removing, you do your gloves, your goggles, you do your gown, and your mask. Is this exam for NCLEX? Well, I was going through just briefly some information regarding the NCLEX. Yes. So it's not entirely all about NCLEX, you know, questions right now. I'm going to talk a little bit about the IELTS exam. All right, but I'm trying to do a series where it's more for transitional nurses, new grads, or persons who are preparing to get their NCLEX done. So the information should help you during that process. All right. So we're gonna look at which patient needs airborne precautions. Is it a patient that has tuberculosis? Is it a patient that has MRSA? Is it a patient that has influenza? So which of these three patients would you put on airborne precaution? So A is a patient with tuberculosis, B is a patient with MRSA, and C is a patient with influenza. TB? Okay, okay. Do we have any other answer? Thank you, Denise, for tuning in. St. Paul. Okay. All right, so definitely, yes, tuberculosis is the option that we will use for, you know, with our airborne precautions. All right, MRSA is going to be contact, and your influenza is going to be droplet. All right, and then they also have health promotion and maintenance, and that covers 6 to 12% of your exam, and the focus is on growth and development. It's also on prevention and screening. So for example, at what age should a baby be able to sit unsupported? So if you have a child, you should be able to answer this one. If not, and you're in school, probably you still have an idea of how to. So if you have a child, at what age should a baby be able to sit unsupported? I think you're trying to say probably 9 months. Ulu. A little close. All right, a little close. All right, so this one is around 8 months. All right, or they can ask you at what age should you start regular mammograms, and it's always going to be dependent on the guidelines. All right, and this is around age 40 to 50 years old. All right, they also might ask you some prenatal care questions like, you know, which prenatal vitamin prevents neural tube defects. You can always go with folic acid because, you know, folic acid is always what we are prescribing, and definitely that's the one that is going to help with that. All right, and so definitely you want to just kind of have an idea, brief idea of some things like that. Then you have psychosocial integrity, which is going to be 6 to 12% also of the exam, and this is mostly, you know, comprised of anything that is related to mental health, coping, abuse, crisis prevention, or intervention. All right, and they might ask a question like, you know, a patient with depression says, I feel like I want to end it all. What's your best response? All right, so if someone says something to you like that, then you want to go ahead and kind of, you know, dig your way a little bit deeper to find out what they're thinking about or what they mean by that. So is it A, you'll say to the patient, don't worry, things will get better. B, why would you feel that way? Or C, are you thinking of harming yourself? No. So you'll ask one of these three questions. Which one would you ask at the time when someone reports that to you? A, you'll say to them, don't worry, things will get better. B, why would you feel that way? Or C, are you thinking of harming yourself? No. C. Thank you, Marvin, for that. Okay, do we have anybody else with any other answer? Okay, going once, going twice. All right. So C is definitely, you know, the question that you would want to ask because you want to find out, you know, if this patient is safe. All right. So you want to ensure safety. You want to ensure that you're direct and the question that you're asking is going to be very therapeutic as well. All right, so a patient with schizophrenia is hearing voices telling them to hurt others. Safe action is always to stay with the patient and assess further to ensure safety of the patient. All right. Then you have physiological integrity, and this is the largest section of the NCLEX exam because you have this area covering about 38 to 62% of the exam, and it has like, you know, like 4 sub areas or categories that they focus on. All right, you talk about the basic care and comfort, that is 6 to 12, the pharmacology and parenteral therapies, which is 12 to 18, reduction of risk potential and physiological adaptation. All right, so for example, they're talking about pharmacological therapy. They might ask you something like, before giving digoxin, what lab should you or the nurse check, and which one would you think of? Or they might ask you, what's the antidote for opioid overdose? So if you're going to be giving digoxin, you definitely want to check for your potassium. All right, definitely want to check for your potassium, because low potassium increases the risk for toxicity when you're giving digoxin. And then for opioid, then the antidote is going to be the naloxone or Narcan. All right, and they might ask you something like, for physiological adaptation, they might ask you a question like, a patient has DKA, which intervention is priority? And then, you know, you'll talk about your IV fluids, and depending on the question, the answers that they provide, definitely you want to always start with your IV fluids to help with flushing out some of those ketones, help with lowering the glucose and all of those things. All right, so definitely you want to focus on that. And as I say, most of the time, the focus is on the care of patients with acute and life-threatening conditions. So make sure you're familiar with your most common conditions, your heart attack, your stroke, your DKA. You understand? Focus on all of those things for your exam. Any question? No? All right. So, all right. So we're going to talk a little bit about the IELTS exam, because as I say, this topic today, we're just kind of discussing a little bit about NCLEX preparation as well as the English exam. And it's more tailored to the international nurses or nurses who are transitioning to the States. Things that they should consider or think about prior to, you know, getting started with the program or with getting their exam or transitioning. All right, and just remember to go ahead and share the live, like up the live, and follow me on YT at ThinkNursing. The entire live will be over there, just like all the other live stream I've done on TikTok here. I'll share them over that side, so they're a little bit long, but it has a lot of information there. All right, so definitely check that out. So we're gonna focus a little bit now on the English exam. So when you're transitioning to the States, you know, one thing they want is to verify, or just to make sure that you know to speak English, let's just say. And a lot of times, you know, the visa and the licensing board, they definitely want to know how well you communicate. And so that's how the IELTS exam comes into play. A lot of times, you know, even though your language in your country is English, sometimes if you're coming with the recruiting company, they will definitely go ahead and have you do the IELTS exam, have that certification to prove that you're competent at speaking the English language as well as writing. So, you know, one thing about you coming here, they want to make sure you're practicing safely as well as you're communicating safely with your patient. And so the IELTS exam is going to help with that as well. So you have the skill, you definitely need to know how to communicate with the patients. All right. So this is that a nurse who understands meds, but a nurse can understand medications but can't explain to the patient about how it can harm themselves, or, you know, how it could be used to be harm them. So you definitely want it to be a case where you're able to, you know, do something and at the same time explain it to the patient for them to understand, because at the end of the day, it's all about safety for the patient as well as for you. All right. So the IELTS exam, it has 4 parts. There is a listening portion, the reading portion, writing and speaking aspect of it. All right. And it is something that is required for all nurses. And there are different versions to it. So the academic version is the one that the nurses will do. The listening test, it may be used by different accents, like, you know, this is the British, Canadian, American, and the Australian. And they give an example where they say a question might be a situation where a doctor is giving discharge instructions and you will need to fill out the missing words. So if you don't understand how to read it, then you won't be able to fill out the paperwork. You understand? So definitely that is something that they might just ask you to do. And the writing task is they might ask you to do an essay. It might be a 250 word essay that you need to explain something. It might be something regarding preventative care. They definitely want you to go ahead and do that essay in the exam, and everything is timed. All right. So preparation tips is that you definitely want to go ahead and start the listening aspect of it. You can do like podcast, you know, just go ahead and listen to different anything. Just go and listen to things and try to interpret what they're saying, understand what they're saying in order to prepare yourself for it. Try to listen to different accents as well. And especially if you know you're going to go to the US, try to find any content that is, you know, has the US accent with it so you can understand what they're saying. So whenever you get that listening exam, you'll be able to, you know, decipher what they're saying a little bit better. All right. Then the speaking the aspect of it, you want to practice that every day. Even recording yourself and answering some questions, that is one way you can actually do that. Then the writing portion of it is where you're going to do a short journal in English. You can start with that, and then from there, you know, you can do whatever it is. So if you want to say, oh, patient is admitted for chest pain or whatever it is, just go ahead and start writing things down so you can actually get a little bit more fluent with reading, writing, and listening as you go along. And then the reading aspect is focus on medical and general articles. You know, practice skimming through and like doing quick overview and scanning, like, you know, just materials so you can actually find information there a little bit easier. So those are the 4 areas that, you know, you definitely want to focus on. And the importance of both exam is that, you know, when it comes on to NCLEX, it's more to allow you to be practicing safe as a nurse. And then the IELTS exam, that English exam, is going to help you to communicate, you know, better as a nurse while you're practicing safely. So both of them is in the safety of the patient as well as for you. All right. You might be able to pass the exam for the NCLEX, and you might probably know how to give the insulin, but you might not be able to explain to the patient what you're giving them, you know, and some medications you probably want to find out if they're taking other things. So you want to be able to, you know, have a conversation with them so they can explain to you, this is what I'm taking, so to prevent any form of interaction with other medications that they're getting. So this exam is going to help with that as well. All right. So both are very important for you working abroad because, you know, you'll need the knowledge and you need the communication in order to be a safe nurse as well as to be successful with carrying out your nursing duties. All right. Thank you so much for those roses, Ulu. Thank you so much, Sonia, Paulette, all of you guys for tuning in. All right. Latibu. Thank you. Thank you. Thank you. All right. So, has anyone done the IELTS exam before or as yet that is on the live? That's the English exam that we have to do prior to moving to the States here. You haven't done it as yet? Okay. Are you in the process of, you know, starting the recruiting program or the transitioning program? Have you signed up with like an agency or anything like that? Okay. All right. So, yeah. I haven't signed up yet, but it's on my mind. Okay. Okay. Nice. 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 All right. So, let's go a little bit with the listening section of this exam, though. It's four parts to it. You have 40 questions, roughly 30 minutes for the IELTS exam. You listen to the recordings with different accents, and then from there you will answer, or depending on what the question asks, you will go about with doing that. And as I say, you might have one that is an everyday conversation, like with you talking with a doctor, and then they'll have you put in different things. You might have a lecture on healthy diet guidelines, for example, and then they might ask you a multiple choice question for you to answer. Then you might have the academic discussion where you might have two students, talking about a nursing assignment, and they might ask you for your opinions or whether or not you agree with what they're discussing. And then 4 is a lecture where there is a university lecture, and it might be about different things. It can be about the spread of infection, whatever it is. It's your responsibility to just go ahead, read the instructions, follow it, and document accordingly based on the instructions. All right. And then the speaking part of it, it's usually about 11 to 14 minutes. It is 3 parts. It's usually like a face-to-face interview. And what this does is it tests your fluency, it tests your pronunciation, vocabulary, as well as grammar. All right. And for the first part, they might ask you, like, where are you from? Why did you choose nursing? And then they might ask you to describe a time when you helped someone, who it was, what you did, how it made you feel, things like that. And then the third part to it is where it's more like a discussion. They'll ask you, do you think nurses should have better communication training, things like that. All right. So as I say, you just want to make sure you're having conversations every day with your friends, your family members, and just make sure you focus on clarity. All right. Focus on clarity when you're doing that, and try to avoid any yes or no answer. So if somebody asks you something, just give as much information as you possibly can, based on how you understand it, and then from there. All right. If you don't understand it, you just go ahead and ask them to repeat it. They will always go ahead and try to rephrase it, and then from there you answer. All right. So regarding the NCLEX and the IELTS, or regarding the IELTS, you have to understand that there is a score requirement that is needed for you to pass the IELTS, and that is 7.0 overall. All right. And with at least 7 in speaking, writing is a 6.5, as well as for the other areas. But you want to get at least a 7. All right. Balancing NCLEX and IELTS prep, you want to ensure that, you're focusing on your NCLEX questions, practicing in the evening and all, throughout the day. Try to have 50 questions that you'll do throughout the day, 75, whatever it is. Focus on probably 2 hours per day, and focus on that. You understand? And then you want to ensure that you're using different resources to help you in the process for your mock exam or for the IELTS exam, the NCLEX exam. So go onto YouTube or YT, go onto UWorld, different sources that you can get, or testing banks that you can get information to help you in preparation for that. But definitely YT, you can always go ahead and find a lot of information regarding the IELTS that will help you as well during that time when you're practicing. All right. So that's about it on that. Do we have any question? All right. Did I miss anything? All right. Do we have anybody that is transitioning soon to the States here, or have signed a contract already? Winsome Lindo, will welcome. Okay. No? All right. Dinafish, welcome. Melissa Morrison, welcome. All right, let me try to do about 10 questions before we go. I have about 15 more minutes. All right, let's see. And we'll try to answer them if we can. I'm trying to open something here, but I'm not getting that. How are you doing, Melissa? I want to find about 5 NCLEX questions here. All of these are trying to... Everything wants you to sign up, and I don't have my little book with me. I'm doing well. Did you work today? Or you're off? You probably ask, who is off on a Monday? Yeah, I have some persons who are off on a Monday. You have some persons who are off on a Monday. There used to be a website you can actually go on to find some questions. I can't find none. Oh, and this book is good as well. NCLEX Prep. This one. That one. Just in case you're interested in one. I think the company had given us one of these. Not back at work as yet. Okay. You're on vacation? And I put up that book in there. Okay, nice. All right, so let me do this one then. All right, so I'll ask you a few questions. I'm gonna do probably 5 questions. Will end anytime soon? FESIM is asking if I think the retrogression will end anytime soon. Honestly, I don't know, FESIM. I honestly don't know. Can't answer that question right now. I don't have an answer for that one. How long have you been waiting? I spoke with someone yesterday. They have been waiting for the last 4 years, which is pretty long. Yeah, it has been like 4 years. That's a long time. I'll be probably a little bit frustrated. Probably have a change of heart or mind. Not saying you're supposed to be, but I just think if I were in your position, I'll be like, disappointed. Passed my exam last year, April. Okay, nice. Congrats. So which country are you in? Good evening, self-love, okay. Oh, you're from Jamaica. Okay, nice. Remember to go ahead and follow my, subscribe to my YT page at ThinkNursing, all right? Okay. Yeah, I'm not so sure. Because I have family members a family member who signed up and it's the same thing. So I don't know. I know a lot of persons. I think the company had said to them that it didn't seem like, things were looking good. So I think some persons they were probably canceling their contract based on what I was hearing. So I don't know what was the, you know, the final thing with some of them, but I know they were saying that things never really look so good regarding the whole, you know, process, and that was just it. So are you with Avant? Hi Kevon 876, welcome, thank you for sharing the live. How are you doing? Angela Blagrove, thank you so much for tuning in. How are you doing? Yeah, so I'm doing good, Kevon. Okay, I'm doing good. I'm here. We're just talking a little bit about, you know, nursing transition in NCLEX as well as IELTS. So kind of just started out a little chit chat here because I was kind of doing this for the entire time. So I have a few persons just talking here a little bit. So I'm just kind of reading their comments and trying to answer. So yeah. Okay, Angela. Nice. Me too. Okay. Are you a nurse practitioner? Okay. So that's just it. All right. But as I say, if you have any questions, feel free to go ahead and ask them down below. Okay, nice. Just go ahead and ask them down below and I'll try to answer them as much as possible. And then from there, all right. Not working now. Okay. I did work today. All right. Okay. All right. So let's ask one question here. Let's see which one. We did ask about the tuberculosis and what we would place that patient on in terms of precaution. All right. So we're gonna do we did talk about the one with the furosemide, losing potassium. All right, so let's try this one. A patient with type 1, I'm preparing for RENR in November. Okay, so you're from the Caribbean, Melissa. Okay, nice. Okay. How is that going? You're studying. I remember I did mine on October, I think it was October 4th, 5th, and 6th. I think it was 4th, 5th, and 6th, or 3rd, 4th, 5th. No, it was a 4th, 5th, and 6th. I did mine on or something like that. How many days? Is it 3 days or 2 days? Don't even remember. Tired? I totally understand. You'll eventually get over it. You'll pass and, you know, it will be behind you. Yeah, just go ahead and make sure you're preparing yourself. It's 1 now? Oh. Okay, let me see. Let me talk with. Let's hear if Feesim wants to come on and chit chat a little bit. Okay. Nurse B, welcome. How are you? Feesim, you changed your mind or it was an accident? Okay, nice. Umblan. Let's see if. Okay. Missed you a long time. Yeah, I'm no longer with that company, dear. I'm no longer with that company. Cut ties. I cut ties with that company. It was just a little bit too much. Sorry. Some of the patients were good, you know, but it was just a little bit too much there. Okay, no problem. Not a problem. You want me to just visit you guys? All right. One day when I'm off, I'll stop by. I'll stop by. Yeah, I miss some of my patients. I did send a message to them, you know, just to let them know that I'm not going to be with them anymore. You know, some of them were planning on switching. I don't know if they eventually did, but I did tell them that I was leaving. They wanted to come with my practice, but I just didn't think it was the right thing to do. So, yeah, let's just say couldn't steal them away. If they come around and find me, then that's different, but I will not bring all of them with me. Thank you. Thank you. Thank you. Tashi, welcome. Angela, thank you for that. Yisha. All right, so let's see here. If a patient has a patient we have is a type 1 diabetic. The patient is sweating, shaky, and confused. What would the nurse do first? All right, and those little simple words first. What would the nurse do first? Yes. What would you do as a nurse? Would you call the provider? A. Would you check urine ketones? B. C. Give a fast-acting carbohydrate. And D is to administer long-acting insulin. So if you're the nurse and you're with this patient, the patient is a diabetic, the patient is sweating, the patient is shaky, and the patient is confused, what would you do at that time? Would you call the provider, check the urine ketones, give a fast-acting carbohydrate, and administer long-acting insulin? A, B, C, D. All right, what would you do at that time? And you can always go ahead and put the answer down that side. Even if you don't know which of them, if it's going to say ketones or whatever, then I'll tell you what it is. So A is to call the provider, B is to check the urine ketones, C is to give a fast-acting carbohydrate, and administer long-acting insulin would have been D. All right, so which of them would you do? All right, so obviously this patient is diabetic, and all of those are symptoms and signs of hypoglycemia. Okay, and so Melissa says C, which the answer is giving fast-acting carbohydrate. Do we have any other answer for that one? So call the provider is A, check ketones in the urine is B, C is give a fast-acting carbohydrate, and D is administer long-acting insulin. Which one would you say it is? Okay. So the answer is actually C. All right. Why C? Because as I said, the patient is showing hypoglycemic signs. And so you definitely want to go ahead and try to correct that. All right. Calling the provider, you can always call the provider and tell the provider. But if you see that happening, what are you going to be doing? Calling the provider while the patient is worsening, getting hypoglycemic. You don't want to do that. Checking the urine ketones. When you check the urine ketones, what is going to happen? You're going to get the result, and how is that going to fix what is happening at the time when you're with the patient? And then administering long-acting insulin. Do you really want to administer insulin with a patient who is already low on glucose? You're just going to worsen their hypoglycemia. So definitely want to go ahead and give that fast-acting carbohydrate. Whether or not it is the glucose tablets, orange juice, definitely find some sugar, whatever it is, put it in the patient's mouth, let them swallow, as long as the patient is awake, all right? If the patient is sleeping and all of those things, then definitely you don't want to give them anything that is going to cause them to, aspirate or choke on it. So definitely check their gag reflex first. But as I said, the situation here, the scenario here didn't make mention of the mental status. So we're just going to assume that the patient is talking. And then from there, you just go ahead and do all of that. All right. Before giving digoxin, the nurse should check what? What vital sign should the nurse check? Is it the respiratory rate, A, B, apical heart rate, C, blood pressure, or the temperature, D? So before giving digoxin, which of them would you do? Respiratory rate, B, apical heart rate, blood pressure, C, and temperature, D. So if you know what the mechanism of action is for your digoxin, then you'll be able to answer the question. All right. So Melissa is saying B. Angela is saying B. Do we have any other? C, D? All right. All right. And B says checking the apical heart rate. A is the respiratory rate. C is the blood pressure. And D is the temperature. All right. And so we definitely want to go ahead with the answer B, which is to check the apical heart rate, because we know that digoxin actually slows the heart rate. So once it is below 60, you will withhold that medication. And then from there, because you don't want to cause further, bradycardia with that medication. All right. Respiratory rate, blood pressure, temperature, not important. And it's not required for, when you're giving digoxin. All right, and we did talk about the tuberculosis. All right. Let's see which one. What is the nurse's priority during a blood transfusion reaction? All right. What is the priority for the nurse during a blood transfusion reaction? A, slow the infusion. B, stop the transfusion. C, to notify the lab, or D, to flush with more blood. Which one would you say? If you notice a patient is having a reaction to the blood that you're giving, what would you be doing at that time? So B, stop the transfusion. Okay, April says B. All right, do we have anybody else? So is either going to slow the transfusion, the infusion, stop the transfusion, notify the lab, flush with more blood. All right. And the answer is going to be B. You want to stop the transfusion. Slowing the infusion is not going to stop the reaction. You have to disconnect the patient from the blood, all right, to stop or slow down the reaction itself to the blood. Notifying the lab is not going to change anything, because the blood is going to still be connected to the patient, all right? So it's going to worsen that reaction. And flush with more blood is not going to cause any change in the reaction status. It's just going to cause more complications. So you want to definitely stop the transfusion so that there's no more blood going in that is causing that reaction with that patient. All right. So you stop, and then definitely you want to go ahead and notify the lab afterwards. They can actually take back the blood and do all those things. You're also going to notify your provider and document. All right. Let's see this one. What's the answer for this one? I think probably it's D. Okay. So which position is best for a patient with increased intracranial pressure? A, supine flat position. B, the treadle. Oh Lord, I'm always having problem with this word. But anyways, the TRENDLENBURG, the Trendelenburg position. C is a high Foley's position, or you might have D, which is the head of the bed elevated at 30 degrees. All right. Which one is best suitable for a patient with intracranial pressure, increased intracranial pressure? D. Melissa says D. Okay. All right. That one. Okay. Angela says D. Okay. Do we have anybody else with any other answer? Okay. So the answer is definitely D. So with the patient having increased intracranial pressure, you want to make sure that you're promoting some form of venous drainage, all right? So you want to go ahead and elevate the head of the bed 30 degrees to promote venous drainage from the brain and reducing that intracranial pressure, all right? So definitely you want to do that A would have been the patient in a flat position. That's not going to be good for the patient. Eye folders, or the other one is not going to be. So the head of bed at 30 degrees is going to promote, the venous return, as well as prevent any compromise with the flow of that blood. All right. So a client is allergic to penicillin. Which drug should the nurse question? So if you have all of these medications given and the patient is allergic to penicillin, which one would you, not give the patient? A, azithromycin, B, amoxicillin, C, ciprofloxacin, D, doxycycline. All right. So once you know the different class of drugs, the medication, then definitely you will go ahead and choose the one that is most appropriate. So the patient is allergic to penicillin. Which drug should the nurse question? Azithromycin, amoxicillin, ciprofloxacin, doxycycline. So Melissa is saying A. Melissa is saying B. Okay, so Melissa is saying B now. Angela is saying A. Okay. Okay, do we have anybody else? Heidi, thank you so much for tuning in. And then April is saying Cipro. Okay. All right. So penicillin, remember the different class of drugs. So the answer is going to be amoxicillin. Amoxicillin, penicillin. Most of the time, the ending for the drugs, they most of the time go with the class. So if you hear penicillin, ampicillin, all of those are part of the penicillin group. So you definitely want to remove that medication. So ciprofloxacin is not a part of it. Doxycycline, nor azithromycin. So amoxicillin is the one that you're going to be questioning. All right. For that patient, because it's going to be, raising suspicion, or you're going to be concerned about any form of anaphylaxis or allergic reaction for that patient. All right. Yeah. And then, let me see. Shalataya. Hello. All right, let me do 2 more and then from there. All right. So the next question is, the nurse finds a patient having seizure. What is the priority action? So you're going to see the patient is having a seizure. What would you do? A is insert an oral airway. B, restrain the client. C, turn the client to the side. D, place a tongue blade in the mouth. What would you do if you see someone actively seizing? You walk into the room, the patient is seizing. What would you do? Would you grab an airway and insert it in the mouth? Would you restrain the patient? Would you turn the patient to the side, or would you place a tongue blade in the patient's mouth? All right, so Angela is saying C. Okay, nice. And C, the answer for C is what? Turn the client to the side. That's what she says. Okay. Do we have any other answer? We have answers out there such as insert an oral airway, turn the client to the side, place a tongue blade in the patient's mouth. Melissa is saying C as well, which is turn the client to the side. Okay. So definitely you'd want to do that. Inserting an oral airway while a patient is seizing probably won't even happen. It can happen, but it's gonna take a little bit of a time to do that, because especially if the patient is clenching down like this, it's gonna be difficult to open that airway, that mouth, and get past those teeth that is like this to get that oral airway in. Restraining the client, no, you're not gonna do that. All right, it probably cause more problem for the patient. And then placing a tongue blade in the patient's mouth is the same problem. You understand? So, and then you probably risk getting your fingertip bite off or something as well. So definitely you want to turn the patient to the side so that whatever they're drooling can actually go out and not cause any form of aspiration. You understand? And you can also be holding the patient to prevent any form of additional injury from all of that jerking, episode that is going on. So the most appropriate thing right now is to turn the patient to the side and just, you know, making sure that the patient is safe during that time period. All right. So a patient with a chest tube has continuous bubbling in the water sealed chamber. What does that indicate? So to all our ICU nurses, what would that one indicate? Or not even to ICU nurses, but you know. A patient with a chest tube has continuous bubbling in the water sealed drainage. What does that indicate? All right, so A is a normal finding, B is an air leak, C is a tube blockage, and D is pneumonia. So A is a normal finding, B is air leakage, C is tube blockage, and D is pneumonia. So D, Angela says D, which is pneumonia, and Melissa says A, which is a normal finding. Okay, do we have anybody else trying to figure out which of them? So if the patient has a continuous bubbling in their water seal drainage with their chest tube, what does that indicate? Is it normal for you to be having those continuous bubbling? Or do you think it is an air leak? Or is it a tube blockage? Or is it pneumonia? All right. So both persons got it incorrect there. The correct answer is B, which is the air leakage. All right, normal finding. That's not a normal finding for you to have continuous bubbling on in your water seal drainage. Tube blockage, no, because if the tube is blocked, you won't be having that bubbling, you know, in the, because you're thinking about like it's kinked, so you're not gonna be having that continuous bubbling there. And pneumonia, you want to find pneumonia like that with a continuous bubbling on the seal, in the water seal drainage. You'll see the pneumonia on the CT scan. You'll hear like, you know, diminished breath sounds also when you're auscultating. So the air leakage is what you'll choose for that one. So if you're continuously seeing that, then that is what is happening. The tube blockage as well, sometimes that you can see where if the patient is having like a tension as well, a pneumothorax, then that is something that you can be concerned about. All right. All right. Okay, and then the last question is, which assessment finding is most concerning in a patient with a tracheostomy? All right, tracheostomy. So is it A, thick secretions, B, oxygen saturation of 88%, C, small amount of bleeding at the site, and D, coughing? Which of them is most concerning for a patient with tracheostomy? Thick secretions, A, B, oxygen saturation of 88%, C, small amount of bleeding at the site, and D, coughing. Tracheostomy was never my thing when it comes on to cleaning. I don't have a problem doing it, but I hated it. Yeah, tracheostomy care. All right. So which of them is the most concerning for a patient with tracheostomy? So you have a patient that has tracheostomy. Are you concerned about the patient having? So which assessment finding is most concerning in a patient with tracheostomy? A, thick secretions, B, oxygen saturations between 88%, C, small amount of bleeding at the site, and D, coughing. So which of them is concerning for you if you have a patient with a trach? The tubing is right here. So are you concerned about them having thick secretions? If so, why? Okay, so Melissa says B, oxygen saturations of 88%. Okay. All right. Do we have anybody trying to figure out A, C, D? So thick secretions, if you have a patient and the patient has thick secretions right in their tracheostomy there, are you concerned about that? Is that most concerning for you? It wouldn't be for me. All right. I would clean up the patient, but as long as it's not thick where it's causing, you know, their oxygen saturations to get low, then it's not like priority. If it is a case where it's thick and their oxygen saturation is low at 88%, then their oxygen saturation definitely is going to be a priority. So you definitely want to go ahead and suction and get that oxygen saturation up. Small amount of bleeding at the site. It's pretty normal to have, you know, because you have airway that has been, you know, placed there. So definitely you might have a little bleeding there. You might have a little irritation there. So that is not priority. All right. And coughing, not that much of a priority either, because a lot of times your you know, the gag reflex, yes, a lot of times you might find those patients be doing all of that. And especially if they have a lot of mucus or secretion, they tend to be coughing a little bit. So definitely you want to just make sure you're clearing that airway properly. So the most concerning thing for this patient would have been the oxygen saturation of 88%. You don't want a patient to be hypoxic, all right? You don't want a patient to be hypoxic. So you definitely want to go ahead and clear that airway of the secretion so that the oxygen saturation can go back up to anywhere between 95 to 100%. All right, and that's about it in the questions there. All right. Hi D, hail Marcus, how are you doing? How are you doing? Soma 11 2011, thank you so much for tuning in. Tamariva, welcome. All right. Oh, and I guess we can do this one day. We'll come and we'll do a marathon one day where we just go through a few questions. All right, just pick our brains for a little bit with some questions. I probably can do that. I don't know which day you guys want to do like some NCLEX questions. And these are same questions that will benefit everybody. So whether or not you're doing the RENR, you know, you will still have it. We'll try to look at the rationale for each of these. And then from there, we can just discuss. And if you want to come up on the live here, we can always do that and just kind of, you know, sit down and encourage everybody to kind of bring them book together and study together. All right. I wish I had this when I was doing my RENR, but then again, I had like really good batchmates, and I love to chat. So, and some persons just love to listen. So I was just like, you know, so it was good. We had a really good team. Well, a classroom, classmates at the time. So it was pretty good. So we did meet up on Sundays or during the week. We'll be studying together, and that was it up until the time of. Thank you so much. Who is that? Melissa. Thank you so much. Not a problem. Oh, and I'm gonna put some I'm gonna do some short content and put it in I'm gonna do some short content, some videos, and then from there. But definitely I would want to do this again where we to do, like, you know, I'm not really strapped for time. So you say Thursday, probably Thursday would have been good. Probably can do that on Thursdays where we just come and just do some questions and answer, and hopefully we'll get other persons to join in for you know, to help them during this time. So I probably can do one for the NCLEX and probably do one for the NP. I don't know. Depending on where the request is coming from or who the request is coming from, we can do that. But definitely especially the ones who are transitioning, you know, because we want to make it in our life. We want to get the RENR. We want to get the NCLEX going because we want to become a nurse, full-blown nurse. You understand? We don't just want to walk around with a bachelor's of science degree in nursing. We want to have the RN as well. So definitely, I think I'm going to focus more on the RN, you know, the new nurses, because eventually, you know, nurse practitioner, they will pass. Them already have them RN. Them already have them BSN, them RN. And MSN. They just need to get the NP license. So definitely I will focus on the NCLEX and the RENR, so it can benefit more persons out there. All right, because I know a lot of us, we need you know, a little encouragement. We need a little support group going, a study partner, so that way when we don't get up in the night, we yawning down the entire place because we're tired and we're alone trying to study and we need company. All right, so we'll do that. I don't have a problem doing that. And then from there, but I'm thinking about probably, I'm going to try to have you guys, go over to my YT page because I'm definitely going to be doing that. I used to do live on, YT. And that was where I wanted to do my study sessions because I have a lot of students over there as well. So I wanted to do my study sessions over there. So I don't know. I'm going to try to see if I can do the live on both platform. But it's just that with YT page now. So that I kind of look like I want a little makeup and them stuff there. Yeah, man. I want a little makeup because I put on a little filter. Not saying that my face looks so bad, but sometimes you just want to kind of not be wearing any makeup at all. And yeah, some days I don't want to be wearing any makeup. So like today, no. But on YT, it's a little bit hard. So this is me today. See? So thank God for filter some days. So I don't even know how this thing go back on. I don't know. Anyways, this is my natural face. Shiny still. God. But anyways, yeah, we need a little filter some days. So definitely on YT. No, YT don't have any filter. You understand? And so I don't want it to be a case where, yeah. But anyways, it doesn't really matter. We just want to get the content going and get persons passing up their NCLEX and, their RE and R exams. So definitely that's the whole point of it. So I think I'm going to do the, try to get both like the phones together so we can actually do the live on YT as well as on TikTok. So both worlds can actually get the content and benefit from it. I want to do nursing. What time on Thursday? So on Thursday, I was thinking about Thursday. What am I doing Thursday? On Thursday, we can do, is 8:30 gonna be too late on Thursday? Not 8:30, 8 o'clock? Because I think I was kind of rushing a while ago to come and do this thing. Because I was at the library. Because I try to do a lot of dictation before I get home. Because if not, then my little boy is just going to be talking. And then it gets captured into the patient's notes. And then I'm going to have to read over the notes and make errors because there's so much chatting in the notes and everything. So 8 o'clock. All right. So 8 o'clock on Thursday, we'll definitely do that. Invite your friends, invite your loved ones. And we'll do this thing for 8 o'clock. I'm going to put it on my calendar so it can remind me. Yeah, I'm going to put it on my calendar so we can do that. And then 8 o'clock on Thursday will come. And that's 8 o'clock for me. I think probably in New York, it would be 9 o'clock. 9 o'clock in New York. I don't know anywhere else in the world. But I know in Jamaica, it will be what? 8 o'clock? So definitely we'll try to do that and then from there, all right, we'll try to be a little bit consistent with it on Thursdays where we do that, and we'll just hang out for the day, hang out for the night, or until the eyes close down, because usually I try not to work on Fridays. Fridays is usually my off day. Thursdays and Fridays try to finish up my notes and everything, so I'll do that and then from there. All right, but what am I gonna do now? I'm gonna get a bath, probably come back around here. Oh no, I'm gonna join a live. Support 1 and 2 persons on their live, and then from there I'll finish up my notes, but I'll probably pop back on if I can't sleep. All right, but until then, Melissa, let me make sure I have you here. Okay, all right, I got you. And my number, you can always inbox me. I have a number that we can chit chat on. All right, I have my WhatsApp number that you can chit chat on. So if you have any questions or anything regarding transitioning, nursing in general, then feel free to go ahead and inbox me, and we can always chat via WhatsApp when I provide that number to you. All right. So in case you have any questions. All right. Okay. Yeah, I'll go ahead and put that on my page so we can make it a little bit more formal as well. All right. Well, enjoy your evening, and it was nice talking with you. Thank you so much for tuning in. All right, and then from there, yes, Melissa. Melissa, which school you went to, or you're going to? I went to NCU, but I need a few NCU folks. I need to get a few persons who are going to NCU to come onto my page because I want to go down to NCU and kind of have a little chit chat with a few persons. But I need some help with getting that started. Brownstone Community College. Okay. Yeah, so definitely share it with your friends, and if they have any concerns or anything, any questions regarding transitioning here, then I am more than happy to answer them, or, just send them over to my YT page at ThinkNursing for them to subscribe, and they can ask any question. As I say, I have a lot of videos over there regarding transitioning and questions that persons have been asking on YT as well as on TikTok here. So they can watch the videos, the live, and hopefully any questions that they have will be answered. All right. But I will inbox you, and then from there. All right, but anyways, guys, thank you so much for tuning in. As usual, I do appreciate you taking the time out of your busy schedule to hang out with us or hang out with me. All right, until then, I'll see you in the next video. All right, bye, Melissa. And all my other folks, sorry.